back to the Golden Canopy Health Management channel. My name is Kevin Lee, and if you have Medicare, then 2025 is bringing some big changes to your Part D plan. Changes like a new $2,000 out-of-pocket cap, simpler coverage structure, and even a way to spread out your prescription drug costs. Now, what does that mean to you? Well, let's find out. So one of the big ones is a $2,000 out-of-pocket cap on Part D. So for the first time ever, Medicare is setting a hard line on what you pay for your prescription drugs. So before this year, 2025, Medicare had a different stage for drug coverage, including a phase where you paid a significant portion of your cost. A lot of you who are new this year to Medicare wouldn't know what I'm talking about, but those who have been in Medicare before 2025 know exactly what I'm talking about. But starting in 2025, once you hit $2,000 in out-of-pocket costs, you won't have to pay another penny for your prescription for the rest of the year. No high cost in the catastrophic phase, just peace of mind knowing there's a limit you'll pay, right? So that is a really huge cost saving for a lot of people who take a lot of prescription drugs. And of course, as you get older, you're not getting healthier. So it is important that Medicare has come up with a way to make sure you're not depleting all your hard-earned money, hard-earned savings on prescription drugs. Another one is a simpler Part B structure. Medicare is also simplifying how drug plans work. Instead of 4 confusing phases, now there's only 3. So phase 1 is the deductible phase. You pay 100% of drug costs until you hit $590. Phase 2, initial coverage phase. Your plan helps pay for your prescriptions and copays or co-insurance. And phase 3 is your catastrophic coverage phase. Now, once you hit $2,000 out of pocket spending, your plan pays for everything for the rest of the year. All right. Now, this makes it easier to understand where your money is going, and it helps protect you from unexpected high costs. So that's a really cool thing that's happening for the 2025 year for those on Medicare. So another one is a new payment plan for out-of-pocket costs. Starting in 2025, Medicare will let you spread out your prescription cost over the year instead of paying big amounts all at once. If you guys remember how things happened before this year, was they had a donut hole, and your first 3 to 4 months could be in excess of $300 or $400. Now, what this does, this won't reduce your costs. It would just make it easier for you to manage. So there's not a discount, okay? So it's a great option for people who hit their out-of-pocket maximum early in the year. All right. If you struggle with prescription costs, don't forget that, but they do have extra help that is available for low-income beneficiaries. And of course, you can always reach out to a health manager at Golden Canopy Health Management, and we can walk you through that process. Now, Medicare is changing fast, and you need to stay informed to make the right choices. That's why I put together a 2025 Medicare guide, which is at no cost to you. Click the link, download the guide, so you can have a better understanding what is happening with Medicare. And if you need personalized help navigating these changes, reach out to Golden Canopy Health Management, and we'll make sure your Medicare is made simple, stress-free, and right fit for you. Please hit the like button, subscribe for more Medicare updates, and share this video with other people. Of course, let me review what we went over as some of the big changes. For 2025, you have a $2,000 out-of-pocket cap. Once you hit that number, your plan pays for everything else. Simpler ways to make the payments, which is it doesn't decrease or put a discount on it. It just makes it easier to pay, so you don't have to pay everything up front in the first 3 or 4 months of the year. Another one is there's a much simpler Part D structure. There used to be 4 phases, now there are only 3 phases. Now, if you still find Medicare confusing, that's okay. That's why we're here at Golden Canopy Health Management. Reach out, give us a call. will walk you through the phases and the steps that you need to know to make sure that your coverage makes sense for you. Thanks so much for watching Golden Canopy Health Management, and you have a wonderful day. Thanks.